Okay, here's my audience.
Good. Okay. Picture yourself unable to speak or understand words the way you do now. Imagine a world where something as common as communication is an everyday challenge. This exists in people who have a disorder called aphasia. In this presentation, I will explain what aphasia is and how it is acquired, the different types of aphasia and the different challenges that a person with aphasia struggles with, and what they can do to make communicating easier for themselves. This will help you understand what a person with aphasia endures and how you can communicate with a person with aphasia. First of all, I will explain what aphasia is and how it is acquired. The Adler Aphasia Center states that aphasia is a disorder that takes away someone's ability to communicate. It can vary from mild to severe, mild meaning smaller problems with communication, and severe meaning the inability to communicate whatsoever. The three top symptoms of aphasia are trouble speaking, difficulty finding the appropriate word or term during conversation, and using strange or inappropriate words during conversation. It can be an isolating disorder, cutting off people from friends, family, and a social life. Aphasia does not affect a person's judgment, memory, problem-solving skills, or intelligence, but it does affect the way they understand others, the way they understand what they read, how they write their words, and how they turn their own thoughts into words through speech. It in no way disrupts ideas and thoughts, it solely disrupts the ability to access those thoughts through language. Aphasia is caused by damage to the brain that controls language and how we communicate. This brain damage can be caused by a tumor, an injection, injuries, dementia, and most commonly caused by a stroke. 1 in 250 people are affected by this disorder, making it more common than Parkinson's disease and muscular dystrophy, and it can occur at any age, in any gender, or in any race. Now I will explain the different types of aphasia. There are 4 different types of aphasia that can be acquired based on the depth of damage done to the brain and where the damage is done. Expressive aphasia is when you know what you want to say, but you have trouble saying and writing what you mean. Receptive aphasia is when you hear the voice speaking, or you can read the print on the paper, but you can't make sense of what the words mean. Anomic aphasia is when you have trouble using the correct words for certain objects, places, or events. And global aphasia is when you can't speak, can't understand speech, and can't read or write. This is the most severe form of aphasia and usually happens after a stroke. Lastly, I will explain the various struggles a person affected by aphasia must deal with and what they can do to make communicating easier for themselves. There are many struggles and challenges that a person with aphasia must overcome. There is difficulty recalling words, even if they are words they have used their entire lives. This is that tip of the tongue feeling when you know what you want to say, but you are continuously searching your mind for an answer that never comes. An affected person may also say a word, but meant to have said another word. This is like a slip of a word, but they don't even realize what they are doing until it has already happened. For example, they know the table is a table, but they call it a chair. Sometimes they even put a lot of effort into thinking about what they want to say, and that can just make things harder for themselves. They may separate out the things that are easy to say from the things that are hard to say, and choose to only attempt the easy things to say. Automatic phrases such as hello or thank you are much easier for a person with aphasia to say because they are used so frequently. People affected also have trouble with writing with pen and paper and using the computer. Words that are very close in meaning, words that are opposites, and words that have an abstract meaning are also difficult words for them to use. These words include man and woman, left and right, and yes and no. There are ways to help the process of communication for an individual with aphasia. After initial diagnosis, education is one of the most important things for patients. Family members should also be included in recovery, and experimenting with socialization strategies will be helpful to the affected person. The use of props help them to get messages through. Drawing words or pictures on paper will help with the actual communication, and by speaking slowly and calmly will help to keep them comfortable and focused. Those who have aphasia should also carry a card on them that states they have aphasia and an explanation of what aphasia is. They should also carry a notepad and pencil on them at all times. Family members should try to ask simple, easy questions at first, paraphrase during conversation, modify the length of conversation, use gestures, and make sure the affected person knows the topic of conversation before the conversation begins. There are also support groups for those with aphasia, such as the National Aphasia Association, the American Stroke Association, and the American Heart Association. When a person is diagnosed with aphasia, the recovery stage begins. Therapy begins immediately after injury. Therapy is built on success, meaning that once the affected person is able to match certain names with certain objects, the therapy continues and becomes more and more challenging. Following that, the person affected will be taught different ways to compensate and cope with their disorder. Therapy includes working in groups, participating in real-life situations, and using computers. After knowing this information about aphasia, it is reassuring to know that even with the challenges this disorder presents and the isolation those affected may feel, most people do recover from this acquired disorder. In conclusion, aphasia is a disorder that takes away a person's ability to communicate and is acquired through brain damage. There are 4 different types of aphasia, which include expressive, receptive, anomic, and global. Those who have aphasia have many challenges trying to make a connection with words, whether they be thought of in their mind, spoken, or written, but they find ways to overcome it by use of props, drawing, and using different communication techniques. We must always remember that whether the aphasia is mild or severe, temporary or permanent, that each individual will have struggles, and their communication abilities will be based on where the brain was damaged and how much brain damage has been done. Thank you.
Okay, and understanding days again.